Half of all Americans have gum disease. It can develop even with careful brushing, flossing, and regular cleanings. It's caused by a specific bacteria within the mouth, and it's a recurrent and chronic problem since the bacteria cannot be eliminated permanently.
Dr. Victor Sternberg and his highly trained team at Westchester Center for Periodontic Excellence focus on treating gum disease in a caring and relaxing environment.
There's been an enormous explosion of technology in dentistry to the point where we can now regenerate bone from patients that have lost it. We can replace teeth with implants. People who lost teeth or are going to lose teeth. However, I've also observed personally over 40 years that the patients that have been taught how to take care of their mouths effectively are the ones that have had the best outcomes, have kept their teeth despite having periodontal disease.
One very effective form of technology in treating periodontal disease is a dental endoscope.
50% of the adults in this country have some level of periodontal disease. The great bulk of dentistry that's done in this country, by myself as a periodontist, and by dentists replacing teeth, is the result of patients not effectively, and I stress effectively, removing those bacteria twice a day. And so over my career, I've developed technology in my office using an endoscope to remove some of these bacteria under the gum. A great deal of the effort in this practice is geared towards teaching people to effectively remove bacteria at the gum line and below the gum line. We have used some very old-fashioned technology to do that. One is a toothbrush. It's a very large-headed toothbrush called a radius brush. And despite all the electric brushes I've tried, this single brush, back to basics, has made the biggest difference, if instructed properly. The other device is a water irrigator, an old water pick that was introduced 50 years ago that's been lost on the shelf for most patients. I find if that's used twice daily for about 2 minutes, and the brushing is 2 minutes, so we're talking about 8 minutes a day, can make the difference between spending your life at the dentist having your teeth replaced or having a healthy mouth.
Despite all the technological and surgical advances, it still comes down to what you do to prevent disease yourself and the effectiveness of early diagnosis and effective scaling that will determine the outcome of your periodontal condition. Westchester Center for Periodontic Excellence, superior experience combined with superior technology in treating gum disease.